Welcome to Staff Box.
Hi, I'm Karen McCabe. I'm an advanced nurse practitioner and I've been working in GP practice for about 12 years, predominantly as a practice nurse and then more recently as a nurse practitioner, as I say. One of the big challenges we face is dealing with diabetic patients, and that's what Scott and I are going to talk about today.
My name is Scott Morgans. My role is a health coach coordinator. I work also for One Wirral. Part of my role is supporting the health coaches within GP practices. And again, what we've seen over the last couple of years has been a significant increase in people becoming sort of diabetic, especially over the kind of last couple of years. So this is why this training has been created.
So one of the big problems I face is lockdown has caused a lot of problems to diabetic patients and to patients generally. And I feel a lot of the time that I have a short limited time, I've got a lot to get through. I need to convince people of medications such as statins, foot checks, and ensure they're doing it all their part of the diabetic care. But I feel like I have the same conversations and I feel like they're not always effective conversations. Sometimes I feel like I'm not giving my patient the right information to go away. There's so much carb confusion, isn't there? And I think that's what this course might be good to help us with as nurses in delivering these better conversations.
Exactly, Karen. I think this course has been created to kind of essentially fill that gap really and fill that void. We understand it can be quite difficult sometimes to attend the right courses at the right times, get the right information at the right times. So the idea of this course really is to kind of look at the growing body of evidence around sort of dietary remission, dietary interventions that are really, really useful within general practice. But for me, I suppose, sometimes I think with regards to the research, it can take a while to filter through into general practice. What we want to try and be able to do is fast track this information, look at the common themes behind these approaches, and then how do we integrate them into a really, really meaningful conversation with a patient to essentially get better outcomes.
Great. There's so much information out there, we don't always have time to sit and read that on top of everything else we need to do as generalist nurses. So, and in terms of delivering those conversations, is there aspects of the course that will help me do that?
100%. So as you mentioned before, with regards to the common themes, what we want to try and then do is filter them through into what's most important for that individual. And also we're heavily focused on sort of that kind of coaching model, the coaching conversations that we'll have with patients. A lot of this course is based around the kind of questions that you can ask patients to better get the right answers at the right times. Also then how to best help that individual during that review or during that appointment that you have.
Brilliant. I think we're not very good at coaching as nurses. We tend to lead rather than coach. So I think that's something that would be really useful to us.
100%.
And do you think there's anything else that we might get from it as nurses?
I think the value of this course really, I suppose, is sometimes courses are delivered and they're just delivered at individuals. The idea of this course is to bring, especially during COVID, bring everybody kind of into a face-to-face scenario where we can learn from one another. There will be nurses that work individually within the practice, and there'll be nurses that work as part of a larger team. So the idea is almost this peer-to-peer learning as well. There's going to be plenty of options for discussion, talking about different scenarios, your experience within practice around these kind of common questions, conversations that you have with patients. So it's not to just say that a lot of the conversations that we're having with patients, some of them will be really, really good. The idea is how do we draw that out and look at that on a wider scale, and again, we get better outcomes.
So it's almost like top tips as well, isn't it, that we're going to get on during the course. And how long is the course? How much time will it take?
The course it's about 6 hours in length. So we'll start around sort of 9:30 and we'll finish around about sort of 3:30. The idea of this course is supposed to try and jam pack it full of information. The idea of this course as well, I suppose, longer term, is to look at some of the outcomes from this course as well. So sometimes it's just a quick feedback form or something like that, which I think is really, really useful. But I think the idea of this is that we keep in touch with maybe some of the nurses that have gone away and started to introduce some of these things within their conversations and see what outcomes they're getting.
How much does this course cost?
So the course is completely free. It's funded by the Cheshire and Merseyside Training Hub. There will be 10 dates that we'll put on across Cheshire and Merseyside for a maximum of 20 delegates. We've kept it at 20, so there's ample room for sort of discussion.
Yeah.
And I would suggest sort of booking them fairly quickly.
Okay, and how do I do that?
Through the Eventbrite link, everything will be sent through to you as well.
Brilliant.
If you have any issues, obviously again, just do reach out.
Okay, great. Thanks, Scott.
Thanks.